Good morning everyone. Myself Dr. Vidya Rani, Associate Professor, Department of Surgery. Would like to introduce my students for a role play sketch regarding the examination of peripheral nerve lesions. Before starting what exactly is the examination part, let me give a brief introduction about what are nerves. So in the nervous system, we have two nervous systems. One is the central nervous system and the other one is the peripheral nervous system. So in that again, peripheral nervous system are again two classification, that is one is somatic and one is autonomic. So somatic are all the cranial nerves and the automatic are the nerves which are already existing in the body whose movements are not recognized by us. So for further examination in detail about each nerve of the peripheral lesion.
Hi. Yeah, what are you doing? Yeah, I miss you. Yeah, I know that. Yeah, you had your lunch. Oh, okay. Oh no, I'm in the gym. Yeah, I'm gymming right now. Kunal, can be on call. Kunal. Yeah, you can be on call. It's fine. Then hold on a second. Muzammil? Oh, what happened to you, bro?
Bro, I just called you.
Hey, it's okay. You come. You sit first. What happened, Ray?
Bro, it's paining.
It's paining.
Yeah.
I think we should see the doctor then.
No, I can manage, I think so.
It's okay?
Yeah.
Yeah, okay, fine. Muzammil, are you alright?
Yeah, I can manage.
Yeah?
Yeah.
Then I'm waiting. I have plans for tonight. So I'm waiting for you outside. You
Sure.
just get fresh and I'll see you, okay?
Sure.
Okay, bro. Muzammil, where are you?
Yes, bro, on the way.
Yeah, I'm waiting. Just come
Yeah.
fast.
Okay.
Come, bro. Yeah, you ready, bro?
Yeah.
Yeah, let's go. Bro, hey, nothing is going right in life, bro.
Oh, I'm sitting with a broken guy.
Bro,
Shut up,
I'm gonna cry, bro.
Bro, I will
I'm gonna cry.
Oh.
Oh, what these guys are doing here? I will make video. I will keep status. Bro, these guys are really suffering. I will call ambulance. Hello?
Ma'am, may I come in?
Yeah.
Come, sit in.
Please be seated.
Good morning everyone present here. Now for the next 10 minutes I would like to grab your attention as we are going to perform examination on peripheral nerve lesions. At first I would like to give a gist about the peripheral nerves. Peripheral nerves are the network of nerves and ganglia which lies outside the central nervous system, which consists of brain and spinal cord. Its main function is to act as a relay system connecting the central nervous system to the skin, muscle, joints, etc. to send and receive information. It has two main components. First is somatic nervous system, other one is autonomic nervous system. Somatic nervous system acts under the control voluntary consciousness of a person. It has again two main subdivisions. One is sensory, that is afferent nerves. The other one is motor, that is efferent nerves. Afferent nerves carry information from the skin, joints and muscles to the central nervous system. The other one is efferent nerves carries command from the central nervous system to the skin, muscles, joints, etc. The other part is autonomic nervous system. It has two main subdivisions. One is sympathetic division, the other one is parasympathetic division. Sympathetic division is responsible for the fit and fight movement. It prepares the body for the stressful situation. The other one is parasympathetic nerves, that is responsible for the rest and digestive functions. Now of peripheral nerves. It has two types, that one is cranial nerve, other one is spinal nerve. Cranial nerve emerges directly from the brain. It has 12 pairs and its main function is to control the sensory and motor functions of the head, neck and thorax. The other one is spinal nerves. It emerges from the spinal cord. Its main function is to control the sensory and motor functions of the trunk and limbs. There are 31 pairs. Hope you understand it. Now we are going to start with the skit.
One.
sir?
Actually, I met with an accident, so I'm not able to move my wrists. Yes, ma'am, he had an accident just recently, and he's not able to move his hand from there.
Okay, sir. Now we have received a patient of trauma. Before getting into the proper examination, we'll take a history of the patient. Good morning, sir. May I know your name, please?
Samir,
Your age, please?
22,
Your occupation?
just engineer.
Okay, sir. May I know where are you living?
I'm in China.
May I know what happened to you?
Just I met.
One.
May I know what happened to you, sir?
And actually, I met with an accident, so I'm not able to move my hand.
Pulse is 70 beats per minute and systolic pressure is 100 and diastolic is 70. As she finished taking the case, now we will proceed with vitals. Before any examination, first you should take the vitals. Sir, check the vitals.
Yeah, sure.
As now we have finished with the preliminary history taking and the vital signs, let's proceed with the local examination. So can you please help me with it?
Yeah, sure.
Let us start with the local examination of the peripheral nervous system. Can you please extend your hands? Can you move your wrist like this? This side one.
Not able to move it.
Okay. The patient has now been able to move his left arm but not his right wrist. This condition is nothing but the wrist drop, where there will be a restricted movement in the arm which is affected but not in the arm which is not affected. The main nerve which is affected in the wrist drop is nothing but the radial nerve. Please extend your hands. And you should flex both your arms. Your right hand, sir.
No, ma'am, I can't.
Move your thumb, sir. Both hands.
With right hand, I can't do any action.
Okay. This condition is nothing but the eighth thumb, where the person will not be able to oppose his thumb with the help of other fingers. In the unaffected arm, he'll be able to have his normal thumb actions, but not in the affected thumb. This is nothing but eighth thumb. And the nerve which is affected here is the medial nerve. Now we'll go with the actions of the shoulder joint. So please extend your arms, both your arms. As you can see, the patient is having a normal movement in his left arm. So can you do the movement? Extend, flex.
In this hand, I can do it, but not in this.
So in the right hand, can you just flex your arm?
No, ma'am. I'm not able to do it.
The patient is clearly having deformity in his right arm, whereas his left arm is completely normal. Here in this, he is having restricted movement at the shoulder joint and at the arm. This is because of the winging of scapula. There is affection to the long thoracic nerve. Because of this, there is prominent medial border of the scapula.
One.
After inspection, we'll go to the palpation, which is the next important thing, under which we'll see 4 headings, which is temperature, muscle, scar and skin. So we'll starting with the temperature and muscle.
I'm going to check the temperature. Normal body temperature is 37 degrees Celsius. Now skin temperature is the standard component in physical examination in the assessment of peripheral nerve lesions. It helps to evaluate synaptic nerve function, asymmetrical temperature findings to indicate the underlying issues. Technique for temperature palpation: first bilateral comparison, second is proximal to distal, third is dorsal temperature. First, in bilateral, we are going for asymmetrical both sides of the body. I am going to check now bilateral comparison. Sir, please can you hold it?
Bilateral, we have to check symmetrical both sides of the hand from right and left. Right. Bilateral comparison means we have to check symmetrical both sides of the hand. So please can you hold it? Wait a second. We have to check both the side of the hands. Right hand is colder than left hand, so you can keep it back. Muscles and the
Why it is closer? Colder.
These are also colder because it can be parallel
Colder.
or there is nerve lesion.
right hand is colder than left side because it may be some damage in muscles. Right hand is colder than left hand. Maybe there will be peripheral nerve damage. Muscles, the paralyzed muscles are wasting in long-standing cases. They are more flabby or soft. The function of muscles will be hampered.
We'll see for the turgor or elasticity. We'll also see for the lesions or masses and sensations. For the turgor, we'll see for the skin hydration. We'll pinch the dorsum of the hand and we'll check for the hydration. So if it goes back, then it is the person is hydrated, and if it does not goes back or it slowly goes back, then the person is dehydrated. We'll check for the dermatomes. So there are, for example, dermatome C5. So over here, if the person feels pain, then that dermatome or the C5 nerve is affected. So we will check here. So we'll see for the T1 dermatome, then C6 and C7, C8. So if any of these dermatomes are affected, the person will feel pain, tingling, numbness or any sensations over that dermatome. If there is no pain, then the person's nerve are not affected. So for example, in case of lesion of axillary nerve, the deltoid muscles will be paralyzed. So if it is dislocation or fracture, the person automatically will not be able to abduct his shoulder. But in case of axillary nerve lesion, we know that axillary nerve will also supply the skin of the lower part of the deltoid muscle. So in that case, we will check for the skin of that lower part of the deltoid, and if there is no pain or no sensation over there, then the axillary nerve is affected in case of dislocation and fracture. Thank you. So we'll see whether any part of the body is anesthetized or not. For that, we will check the dermatomes and also the skin texture, which is already been done. I'm here to palpate the scar. I used the fingertip, gently touched the scar, and patient felt pain. Here the patient felt the tenderness or pain. The presence of the triggering point causes the neuralgic pain, and it is main key indicator of the nerve pain. And next one, texture and consistency. Sir, can you keep the hand? Sure. Scar should be palpated for the tenderness. Sorry, are you feeling any pain?
Yeah, ma'am. A bit of pain.
Are you feeling any pain?
Yeah.
Okay. Or texture and consistency. Texture was firm and there is no nodules. And the scar is thick tissue, causes the nerve pain. If from any trauma or surgery, the scar will start the healing point. The healing point is essential for the formation of fibrous collagen tissue. It involves the delicate peripheral nerve.
Today we'll be explaining about the examination of median nerve. Before doing the examination, let's understand the anatomy of median nerve and its clinical lesion.
Now we are going to know about the anatomy of median nerve. The median nerve is the major peripheral nerve of the upper limb. It supplies muscles of the forearm and hand muscles. Origin: it arises from the brachial plexus by the fusion of lateral cord and medial cord and course. Now in arm, it
goes from lateral to medial of the brachial artery, and in cubital fossa it is medial to the brachial artery, and in arm it passes between the flexor distorum superficialis and flexor distorum profundus, and in wrist it passes beneath the flexor retinaculum. It passes in the carpal tunnel, and it supplies all the muscles of the forearm except flexor carpi ulnaris and medial half of flexor distorum profundus, and it supplies the sensory supply the lateral 3/4 of the hand, and its actions are pronation of the forearm, flexion of the wrist, and flexion of the thumb. As we learned about the anatomy, now let me tell you about the clinical lesions of the median nerve. So mainly in kids we see that there is lesion of median nerve by supracondylar fracture, which is due to the extension of arm when the kid falls. And in adults it's usually hand of Benedict and carpal tunnel syndrome. Hand of Benedict is when there is proximal median nerve lesion, and distal median nerve lesion causes carpal tunnel syndrome. In hand of Benedict, when there is paralysis of the median nerve, and when we pinch this part of the hand, there is no sensation for the patient. And in carpal tunnel syndrome, the patient cannot extend his fingers.
As they have described about the median anatomy of the median nerve, the median nerve supplies the most of the forearm muscles. In case of any lesions to the median nerve, it can cause paralysis of the forearm muscles. For example, to examine the patient, we have to take the proximal of the thumb and the terminal phalanx of the thumb. We have to ask the patient to flex the proximal phalanx of the thumb and terminal phalanx of the thumb. If the patient is any lesion to the median nerve, the patient cannot flex his thumb. In normal, first we have to take the terminal phalanx of the thumb, while we have to stabilize the proximal phalanx of the thumb. We have to ask the patient to flex, bend. In normal people, the flexion can be seen. As I have shown normal, this patient is having the lesion to the median nerve, so he cannot perform this. As we have shown the normal, the patient cannot perform this normal thing in there. This is now abnormal. He cannot flex the thumb. Another test is oscular clasping test. Now we have to ask the patient to clasp the both hands. And clasping is gripping, and if there is no any median lesion, there will be clasping will be alright. And if any lesion to the median nerve, the index finger cannot clasp because of paralysis of the flexor distorum superficial muscles and profundus. Now I'll show normal thing. First, hand clasp. This will be the normal clasping of the patient. This is the normal condition. If the patient has lesion to the median nerve, he cannot clasp, and he will be pointing the index finger. This is known as index point.
Going to do the manual examination of abductor pollicis brevis and the opposition pollicis. These two are the tenar muscles which is present in the hand. The abductor pollicis brevis is the tenar muscle which is present in the hand, and this can help in the flexor and the abduction of the thumb finger to the carpo-metacarpal joint. This is a flat muscle which is present in the palm, and this is the branch of the median nerve. Now, if we will examine the test on the patient. This test is known as pen test. We ask the patient to raise his thumb finger, and we ask the patient to touch this pen with the using of thumb finger. You can touch it. So here the patient has no abduction of the thumb finger, so it is an abnormality. We can see this abnormality in the carpal tunnel syndrome, where there is weakness in the muscles and the median nerve will be damaged. Now, the second test will be opponent's pollicis. This is the tenar muscle which is present in the palm, and this helps to swing the fingers and help the movements of the fingers. Now, to test for this test, we ask the patient to touch his thumb, tip of the other fingers by using the thumb finger. Touch your other fingers by using thumb finger, like this. So the second test is opponent's test. Now, sir, can you touch your fingers by using the thumb finger with the right hand? So can you please do with the left hand side? So here there is a paralysis in the right hand, as the patient is unable to touch this his tip of the fingers. So there is no abnormality present in the left hand. So the patient is able to touch the fingers. So there is a paralysis here and there is no paralysis as we see. Thank you.
Now he cannot move his hand. Sir, let me check. It may be a heart attack case. Heart problem is for me. Damage is for me.
Good morning.
Morning.
What is the problem? What is the case?
It may be a heart attack case.
Heart attack. Having problem on the right side. So what's your problem?
So there is a numbness, pain, and I can't move.
You have a problem in the ulnar nerve.
Sir, I know about the ulnar nerve, sir. Sir, ulnar nerve, sir, it is the main nerve of the body, sir. It lies superficial to the flexor retinaculum, sir. It is covered by the slip of the retinaculum, sir. It has two branches, sir, deep and superficial branches, sir. Superficial branch is cutaneous, sir, and deep branch goes into the hypothenar muscles, lying the hypothenar muscles and supplies the adductor pollicis, sir. I know it, sir.
What is abnormality in this?
That's why I didn't study, sir.
Your holiday on that day?
Sir, I was absent, sir.
Yeah. This is the case of ulnar claw hand. It happened because when he met in an accident, his ulnar nerve would have compressed. So this is why it happens. So this is a normal hand where see, you can see the fingers. It got. So you can observe here. There's a flexion of interferal joint. Where it is a normal, and he got a flexion of the interferal joint. Now you can see the flexion of interphalangeal joint here. Now, there are many other tests to confirm the final diagnosis. Now we'll send the patient to the further investigation.
Hey, they don't know anything. This is median nerve problem.